Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA, host of the MGMA Podcast Network. All week this week, we are doing a special series in honor of National Medical Group Practice Week. And we are so excited to have another practice leader here today, and it's a return guest to our podcast. We've got Dea Robinson. So welcome back to the show.
Thank you.
Yeah.
Good to be here.
It is so good to have you in studio. We've had you in studio for both episodes. We've had you because we live down the street, so to speak, or work down the street from each other. So before we get into some deeper questions, just remind our audience, where do you work and what's your role there?
Yeah. Currently, I am the Director of Hospital Medicine Programs for CommonSpirit Health for the Mountain Region, which includes Colorado, Kansas, and Utah. Okay. And so what I do is I'm a leader, non-clinical leader in a dyad relationship with another clinical leader, and I lead the hospitalist team, palliative team, and critical care, depending on the site. So about 200 physicians.
Okay.
All in.
Wow.
Yeah.
And you've had a relationship with MGMA for years and years. We're going to get into that as well. But we're going to talk about some leadership aspects of your career right now. So when you look back over that career, give us a highlight or two that really stands out to yourself, that maybe it's something you're proud of, something that you want other people to know about.
Great question. I think a couple of things. One in particular stands out. When I realized that I was in a leadership role, this speaks to people that if you think you have to be leading hundreds of people to be a leader, it's simply not true. It was when I started a private practice, primary care, with one other doctor, and I realized that I didn't have my mentor, which we can get into later, at my side anymore, who I met through MGMA. I was on my own. I didn't have a nurse. I was the staff.
Wow.
I did the billing. I did the chaperoning. I did charting. I did all of that stuff. And I realized that it's just me. And it was a big responsibility, but it was an incredible experience that I needed to have.
Right.
To set the stage.
Yeah.
You know?
I mean, that's just kind of jumping into the deep end, right?
Oh, yeah.
Yeah. You were talking about dyad leadership, and there are other aspects and types of leadership.
Yeah.
When you think about yourself as a leader, how do you define yourself? What category or persona do you fall under as a leader?
I love that question because I love the topic of leadership, but I think we fall into that habit of going, what am I? Am I a servant? Am I
right?
And I think the reality is that we wear a lot of different hats when it comes to leadership, and we can be a servant leader one day and whatever the situation requires another day. For me, I would say, after looking at leadership and studying it, I'm a transformational leader. I'm the kind of person that when I have my team, I set the vision and I label it and name it, and I don't tell them how to get there, but I tell them I'm here to help them get there, but that's where we're going.
Yeah. If it's okay with you, share an example that shows you working as a transformational leader, something that really showed that aspect of your persona.
Mm-hmm. Yeah, I'm actually in the thick of it right now. I started in this role approximately a year ago, and we had a little bit of turnover. I have two practice managers that report to me. And so it was opportunity to hire in a new manager, which I did, and my other manager had been around for a while. And there were just a lot of, you could say, inefficiencies, but things that were happening in one market that weren't happening in another. And I was looking at excellence. And so what I was trying to help us kind of co-construct is, what does excellence look for us now? and what is excellence going to look for us in a year. Some of those things were really tactical and operational. So for hospital medicine, it's patient distribution. So we want to get to patient distribution across the region. But when it's not happening in the same way, what can we do? What can I do to help my one manager get there? And how can I also support my more experienced manager to coach and mentor that other manager? So it's putting it out there and then kind of coming back and allowing them to create this culture of learning and still having that goal that I've set that I'm not wavering on. It's like, and allowing them to stumble a little bit. Sometimes I stumble too.
Yeah, we all do.
Yeah.
This is so interesting hearing you talk about your career, and you've done everything from basically, I mean, a mom and pop type operation where you're doing everything, and now you're in a really big system where you're wearing a lot of hats, but in perhaps a different way. Give us one similarity that just transcends size of practice, and then maybe a seismic change or difference in going from a smaller practice or a larger practice, because we're going to have people listening who come from all practice sizes.
I would say that the one similarity that doesn't go away is having a dyad partner. I'm a big believer in the strength of a dyad relationship that is strong. And I know some of those principles come out of MGMA, but I can't really emphasize enough how much you can achieve when you have a strong dyad partnership. So I still start my day with my dyad partner physician in the morning, what's up? What are we doing today? His phrase right now is top of the morning to you. And I'm always thinking, I'm not sure if that's a good way to start the morning. But that, to me, that's not going to go away, because I think we've learned that, clinicians cannot do everything, and non-clinical leaders cannot do anything. And so that beauty of a dyad relationship that works. And I have been truly blessed to have, I started counting the other day, how many dyad relationships have I had? I've had 12 over the years, and all of them are distinctive and not all of them perfect. And then some, are much stand out more than others, but
yeah. And then just following up on that, what is a tremendous difference per se of being in a smaller practice and being in a large system?
Yeah. One of my internal sayings that I run in my head is, the larger we become, the more granular we need to be.
Okay.
And I cannot help but reflect back on a day-to-day basis on how much more nimble you can be in a private practice. The decision-making is it's faster. There's less layers. Large integrated systems were around, but as we all know, it's gone to the point where I think up to 70% of physicians are employed by a system. And so that honestly makes it really challenging on a lot of days. Yeah. Especially if you came from a private practice. And I'm working with younger physicians and younger non-clinical people who never had that experience.
Right.
And it's really difficult to even translate that experience to let them know how much more the physician was in the driver's seat in many ways. Right.
Yeah, I have been in media for 30 years or so, and 2 different times I got hired by an actual mom and pop, family-owned media company. 2 different times, about a decade apart, they were bought by pretty large New York media companies. And you just overnight, I'm still doing the same thing, running a magazine, and yet so much of it is so different. And you just, that cultural difference administratively red tape wise. And is that what you noticed as well?
Yeah, no, that's a great analogy there. I think, it's this coming from a private practice, you're used to doing everything.
Yeah.
And then you get to a system where, okay, I don't have to do all of the HR. I don't have to do all of the finance. But you interact and intersect with all of those areas or those domains that having some kind of knowledge of really helps, but not being completely responsible for it. So it's a different type of relationship building versus being solely responsible for all of it. Has its pluses and minuses for sure. Some of the risk is certainly spread out a little bit more when you're in a larger system. But there's nothing like, to me, running a private practice and allowing physicians to really find their way as owners and really having that kind of skin in the game. It's just different. One isn't better than the other.
Right.
It's just from a participatory standpoint, I'm looking at going, wow, some of the best lessons I've learned was from a physician that we started 3 tax IDs together. And some of his advice, never being an owner, I still use.
Wow.
So.
Yeah. And I think part of it is just really learning about yourself as an employee, like, where do I fit? Do I fit more? And when I'm wearing lots of hats and maybe we don't go 10 miles deep in any area because I've got to wear all the hats. And what you said at a larger system, you're not doing as many different things, but you might need to get very granular in that particular area. And just having that self-awareness if there is the opportunity to move, and to look, where do I fit?
Right.
Yeah. We'd like to take a quick break to highlight the exclusive offers available during National Medical Group Practice Week. From January 26th to the 30th, MGMA is offering special savings on membership, ACMPE certification, and professional education designed to help you strengthen your skills and advance your career. Learn more at mgma.com/NMGP-week. Now, back to our conversation. You have had a distinguished career. You have had a career that's taken you in a lot of different places. Healthcare has evolved. We know technologically and digitally, and yet we joke at MGMA because we're coming up this year on our 100th anniversary, and yet we have some of the same problems we've had for 100 years.
Exactly.
So things change. They say stay the same. But throughout your career, how do you stay motivated? What gets you up in the morning to want to go into that office and say top of the morning or not top of the morning to your colleague there? What's that all about, and what motivates you?
I think that's part of it is, I don't know, someone said this somewhere. It's the people that you work with that really makes the job worth it. And it's still the people that I work with, that the challenges are the same. We still have staffing problems. We still have surge problems, at least in my specialty. That's not going to go away. The models of care, have they changed dramatically? Maybe a little bit. Is AI really going to make an impact? Maybe. But it still comes down to developing human connection that motivates me the most. And I think the other thing is really helping the next generation, which requires a different kind of patience that I've cultivated over the years, but it's really very rewarding to be able to cultivate the next generations of physician leaders.
I mentioned it earlier, but you have had a long-standing relationship with MGMA. Talk about what that's meant to you as a practice leader, what you've gotten out of it, what you've enjoyed most about that relationship.
That's probably the hardest question of all today. Thank you. Because my relationship with MGMA, I would not be where I am today without MGMA. And I'm not saying that. I'm saying that seriously. Mm-hmm. I met my mentor at a Colorado MGMA conference, and she changed everything for me. There were no healthcare management courses or anything like that that were in existence at the time. But her friendship and her mentorship gave me the confidence. And then she encouraged me to join National, get involved. And, some really pivotal moments for me with National MGMA was my specialty didn't exist before 2000. Wow. It evolved out of a need back in 1998, between 1998 and 2000. That's right around the time that I was getting involved. I was on the board with Colorado MGMA. And I don't know if anyone remembers this, but we used to have a structure of assemblies.
Okay.
Primary care assembly, ortho, all of the different specialties. But we did not have a hospitalist assembly. And I was able to kind of grow my wings and started my own assembly with MGMA. And it was just a great feeling because it was no, the specialty is here and it's not going to go away and we need to be included. And they listened.
Right.
So, and there, before you knew it, we went from 10 people at one conference to 80 to the next. I mean, it just was, now it's huge. It's a huge specialty. But that was very pivotal for me. And quite honestly, the friendships. Yeah. I know a lot of my colleagues that are still involved with MGMA say this, but it's the friendships that you create. I mean, the depth of those friendships, not just because they understand what you're doing for a living, but you just have a different and unique type of relationship, and I definitely benefited and continue to benefit from that.
Yeah, it's so interesting that you say that because we have talked on the MGMA podcast to, I don't have an exact number, but I would say at least 250 practice leaders over the last 7-8 years. And when I just say, what was your entry point to MGMA and what has it meant to you? I would say there might be some other aspects, but it always comes back to the networking / friendship / mentorship, something in that sphere where it's really, as you mentioned, it's not just, I'm not alone in this, but, you've been through things not side by side, maybe even across the country, maybe even in different countries, but you really have an understanding that's very unique to practices and that settings. Anything else you want to share about that? Maybe it's from the mentorship or friendship or networking side of it.
Yeah, I have to mention this. So 2013, my practice dissolved. Didn't know what I was going to do. I still am in contact with my mentor. I said, I don't know it. She said, why haven't you fellowed yet? And, at that time, I'm like, why? I don't even know what I'm going to do. Mm-hmm. I really did not want to. The healthcare landscape was moving to integrated care. I had only known private practice, and it was at that point that I went back to graduate school. But I had this interim time, and I thought, okay, fine. I will look at getting into my fellowship. So I did. Mm-hmm. Got my fellowship. Went to the national meeting. That was in San Diego that year. And I just can't, I don't know. I hope I can convey where I was at that point. I had had a wonderful career at that point, 25 years on one hospital campus, 3 different practices, a consulting group with my docs, but I had no idea what I was going to do. And I received my fellow, went to the dinner. I had heard that it was a great event. I had no idea how special that night was going to be. It was absolutely transformational. And the way the other fellows brought in the new fellows, just like a great big warm embrace, which I really needed at that point. But I just cannot even tell you how much that meant to me professionally. And to be honest, I didn't know a lot of the people that were fellows at that point in time. But that moment, that night was so awesome. I just can't. I have to let people know.
Yeah.
Don't hesitate.
Right. Final question then. You've had, as I said, a long and distinguished career. You are a fellow. And for people who are listening, maybe they're early careerists, maybe they're mid-careerists, maybe they're later in their career. But as we've seen since the pandemic, there's been a lot of people getting out of healthcare, particularly on the clinical side, but a lot of other people have just burned out and just had enough of it or just feel maybe frustrated. What advice would you give them to look for, reasons to stay? You're not trying to talk to somebody who's definitely getting out, but maybe somebody who's on the fence or just wants a little inspiration, wants a lift up, just like you were talking about with that fellowship. What's some advice you would impart on anyone wanting to stay long haul in healthcare, but maybe really feeling the challenges of it as well?
Well, I think there's probably two pieces of advice I would probably give. One is to stay curious. There's tons of research on lifelong learning and what that does, but I will tell you right now, I still go to work and I don't know everything. Yeah. We all are learning something all the time, but maybe stay curious about some area of the industry that you may not know anything about. It could be anything. It could be unrelated to your care area. That would be one thing. And the other thing is I would say give back. And it doesn't matter where you are in your career. You're going to give back different things depending on where you are in your career. But I think volunteering, like with MGMA, really, it really truly does feel good to give back to other people. And you learn so much from when you do that, when you have those moments.
Yeah.
So.
Well, Dea Robinson, thank you for giving back to us, and thank you for joining us on the podcast today.
You're welcome.
All right. Well, everyone, we have been talking with Dea Robinson during, I'm going to get it right, National Medical Group Practice Week. And we're going to be talking with practice leaders all week and sharing their stories and sharing them with you. So thanks to everyone for being MGMA podcast listeners.